Nowadays, every people is reaching for the best body, and there are a lot of ways how you can improve your body, and one of them is plastic surgery. Plastic surgery lets you very fast and easy and safe to improve almost all parts of your body. Hello, I'm Dr. Tomas Budrius. I'm plastic and reconstructive surgeon. There are a lot of cases when patients are coming to us and asking to improve their body, especially the women are considering about the breasts. Sometimes they have too small breasts, sometimes they have too big breasts, and in the end they want to have the perfect breast. With plastic surgery, we can achieve that perfect breast results. Nowadays it's quite easy because we have a lot of technique how to do that. We have a lot of implants, manufacture some implants, and we always using some kind of technique, and we are discussing with the patients, and then in the end we can reach the final and the perfect breast result. The main thing is to discuss with your surgeon how do you imagine your body after breast augmentation and what you are looking from the surgery. In this case, usually you need to have a contact with your surgeon, then it's easier to understand each other, and it's much easier way after the surgery. Usually the surgeon is measuring your body, measuring your chest wall, your breast width, then we are calculating some kind of numbers, and then we can say which implant is the best for your body, because each body has their own size of chest wall, of the footprint of, and if we are seeking the perfect breast, we should always take care how your chest wall looks and how your body is. After that, we can choose implants, and we can choose in a not so big range, but still we have a range to choose, and we can choose the size, the projection, the volume, and so on, and it depends what kind of breast do you want. Then we will reach the final and the perfect breast. The first step should be you should talk with yourself. Do you really need that, and do you want that? And if you are clear with yourself, then you should find a surgeon. When you will find your surgeon, of course, you should have a first consultation. Usually it's done by writing, by emails, or by other ways. And sometimes the first consultation is with the manager of the surgeon, not with the surgeon. But if there is a reason, or if there is a needed, you can always contact directly with the surgeon. Other things, your body condition should be also very good, and there should be no other reasons to worry about when you are going to the surgery. So from our side, we always asking the patients before coming to Lithuania to have a surgery, go to your family doctor, have investigations, and just give us an answer that it's safe to perform the surgery. Then, if everything is safe, we are waiting you to coming here. When you are here, you will have your consultation with the doctor directly. In the discussion style, you have the measurements, you will choose the implants, everything will be explained more detailed, and then there will be the surgery. Breast augmentation surgery can be done in a lot of ways. One of the ways to put the implant inside the breast. The other way is we can improve the breast shape and the volume with the own fat transfer. And also there are other surgeries from the breast, like breast reduction or breast lift. It depends on the condition of your own body you have it now. So if we are talking about breast augmentation, usually it's done by two choices. So there is just breast implants or fat transfer to the breasts. Usually fat transfers has their own limits, because we cannot transfer a lot of fats, because the fats needs to survive when they are in the new tissues in the breast. And in this case, we can improve the breast shape, but usually it's a not so big improvement. If we want to improve our breast more visible and we need more volume, so I always advise to choose the implants. You don't need to be afraid of the implant. Nowadays they are safe. We are using all manufacturers, all worldwide manufacturers implants. so you can choose whatever you want. They are safe, they have a warranty, and usually there's a very low risk of complications. We have different kinds of implants. We have anatomical shape implants, we have round implants, and we have even Motiva ergonomic implants, which they are saying something between the round and between the anatomicals. So comparing everything, we can choose the best implant for your body and to achieve the best results. During the consultation before the surgery, we will discuss what kind of implants you need and you want to achieve the best results and the results that you want. Usually how everything is done, you are coming to Lithuania to the hospital. First, you are having the consultation with the doctor. After that, you are going to your ward. Then usually you will have a consultation with the doctor anesthesiologist about the anesthesia. And if there is no risk and everything is safe, we can go to the operating room. You are going to the operating room, you will have anesthesia in the operating room. So that means that you fall asleep on the table in the operating room. Usually the surgery is quite easy. It's a short surgery, 1 hour. You are staying in the hospital after the surgery just for 24 hours. Then you can leave to your hotel. But we're asking to stay in Lithuania for about 5 or 7 days. There is no pain during the surgery because the surgery is done under the general anesthesia. So that means you are falling asleep and you don't feel anything. Also, after the surgery, there is no pain too. Maybe there is a tension feeling in the chest wall, or you feel that something is compressing your chest wall in the first days. But usually there is no pain because we are giving a lot of painkillers, and there is made a local anesthesia during the surgery, and the pain is disappeared for at least 24 hours. After that, the pain is getting better. The pain or the tension feeling is getting better every day, and usually after 3-4 days, you don't feel any discomfort. After the surgery, there's 2 postoperative periods. One is the early postoperative period, and the second one is the lately postoperative period. In the first one, in the early period, we are always asking for the patients to stay in Lithuania for at least 5 or 7 days, because in these periods, this is the period where we can see if there's something goes wrong. It's very rare, but still sometimes it happens. So usually we're asking the patients to stay for these days. They are having the whole support and they are close to us. And if there is a need, we can always help them to solve the problems. Usually in these days, the patient is staying in the hostel or hotel, and we are always working all 24 hours. And if there is a need, we can always reach, the patients can reach us and we can reach the patients. The postoperative wound care is very simple. You don't need to do anything special. There are stitches, but they are resorbable, so you don't need to remove them. Your main work is just to change the plaster once a week, and that's it. After 1 week, you just take off the old tape and put back a new tape. And after another week, you just remove everything, and that's it. Usually the wound is healing about 2 weeks, and after 2 weeks, it's safe to be without any special dosages or something like that. After 5-7 days, the patient can go back to their country. Usually before leaving Lithuania, we have the final checkup, and just to make sure everything is clear and everything is safe, then the patient can leave. Then there is a late postoperative period. In the late postoperative period, you have some recommendations that you need to follow up to achieve the best result. So after the breast augmentation, it's important to avoid some special exercises or some activities in the first 2 weeks and maybe first 2 months. And you need to wear a special bra for 6 weeks, 6 or 8 weeks. And it's also very important to understand that the final result will be seen just after 2-3 months, when the swelling from the breast, from the tissue, is disappeared. So usually in the late postoperative period, you don't need to do anything special. You just need to follow some kind of recommendations, and that's it. There are recommendations for the whole life. A lot of patients are worried about the breast implants. Are they for all the life or no? Usually, if everything is okay, so the implants can be in the body for all time. When 5 years passed after the surgery, you should always make an ultrasound test once per year, and if everything is okay, so you don't need to worry anything. If there are some changes in the breast or the breast implant, so you need to consult with the plastic surgeon. Why you should choose us? I think Lithuania is a part of the European Union, and the quality in the medicine in Lithuania is really high, even comparing with the Europe standards. We have a lot of patients coming here to Lithuania for the surgeries from Scandinavia and from other Western European countries. The reason is the quality and the cost effectiveness, because here you can get and the quality and the cost effectiveness. You will have all the support, not even the medical part, but also the logistic part. You will have your own manager, and usually they are helping the patients to communicate here in Lithuania. They are helping to choose the hotel. They are transferring the patients to the clinic, to the hotel, and so on. So you always will have a support and medical and your own manager who will help during the staying in Lithuania. If you have any questions how you can improve your body, not only the breasts, but all kinds of plastic aesthetic surgeries in the body, that includes face, body contouring, rhinoplasties, and other surgeries, please contact us. We will try to answer all your questions and support all the needed information for you to achieve the best body you are dreaming about it.